Let me introduce myself. I'm Dr. Raman Kapur. I head the Department of Medical Acupuncture at Sir Gangaram Hospital, which I started about 26 years ago. And I've been practicing acupuncture in New Delhi since the last 41 years. We have been doing therapeutics because of our practice, which is a very active practice. So we have been using this in our clinic and with great results. So I wanted to share this knowledge with my colleagues, with all of you, so that you can also use it. It's so simple and yet so effective. What is PNST? So PNST, as the name term says, is Prickling Nerve Stimulation Technique. In this, what we actually do is we identify the area of sympathetic harm. Say for example, patient has pain. So the area of his sympathetic arm is that area of pain. So we will have to find out identify the sympathetic harm area, then identify which particular dermatome is supplying that sympathetic harm area, and accordingly designate a treatment plan. And this is the dermatome chart is not used only for diagnostic, but it is also used for therapeutic purposes. So the same dermatome, once you understand the dermatome patterns, you can use the same knowledge to treat also patients as you find out which dermatome is affecting which particular part of our body. The anterior and posterior view of the 30 dermatomes which I talked to you. So the cervical dermatomes, C2 is supplying the lower jaw, the back of the head. So C3 is supplying the upper neck and back of head. Then the thoracic dermatomes from T1 to T12. Now we will talk about the acupuncture points on the back. So this gives you an indication of there is an overlap between the dermatome points, as I was talking to you, and the acupuncture points. So a lot of you who are into acupuncture practice, they know that the acupuncture points on the back are located on the spine and on the sides of the spine at regular intervals. And the back acupuncture points and the dermatome chart, that seems to overlap in the DU channel and the UB channel points. And most important, for stress, for sleep disorders, for all central nervous system disorders, the basic PNST treatment is sufficient. So we are, the first phase of my talk is now done.